Okay.
Hi, my name is Becky Brockman. I am going to show you how to do a dressing change on a PICC line. Before you enter the patient's room, you need to make sure that you have a doctor's order. You need to make sure that you check for allergies, such things like chlorhexidine, iodine, latex, or cleaning solutions that you may be using that the patient could potentially be allergic to per facility. You need to gather your supplies. Go ahead and knock on the patient's door. Hello, provide for privacy. I'm going to wash my hands at the sink. Come to the patient. Hi, my name is Becky. I'm going to be your student nurse. Jennifer, can you verify your name and date of birth? She verifies that her name is Jennifer Doe. Her birth date is 11/5/75. I verify that that is her name according to the MAR. I am going to be doing a PICC line dressing change. Doctor has ordered. She verifies that that is okay. She does not have any questions. She understands the procedure. She verifies with me that she is capable of understanding. This is a sterile procedure, so I will need you to go ahead and put on a mask, okay? She says okay. Go ahead and wash my hands. Now, if she was unable to put on a mask, I would have her go ahead and turn her head to the opposite side of wherever I was changing the PICC line to. Okay? So I'm going to go ahead and wash my hands. I would go ahead and get out my dressing, my package. Of course, it would be closed. I would make sure that I verify that it is not expired. I'm going to go ahead and open it. Take out my mask. Put my mask on. I'm going to wash my hands. And then I'm going to grab my gloves. I'm going to make sure that I measure from the incision site 6 inches up. From right here, I'm going to measure around, and this measures 9.5 inches. I'm also going to measure from here all the way down to the end of the catheter site here. That measures 5 inches. The reason why you want to do that is so if there's a 1/2 inch of difference, that could mean that there is phlebitis infiltration. Possibly the PICC line may be coming out. So you want to make sure you make a note of that and note if there's any changes you may need to call the provider. I'm also going to check the site. You're going to assess for Rita, so redness, there's no redness, ecchymosis, no ecchymosis, there is no edema, there is no drainage, and it's well approximated. I then am going to go ahead and remove the dressing. So starting with that, I'm going to take that off. And then I'm going to start taking the bandages off. You're going to want to start from the outside and work your way towards the incision site. You're going to want to make sure that you hold down onto the PICC line itself, just for some extra support. Okay. Okay. And once I have that off, I'll go ahead and throw that into the garbage. I'm also noting that the PICC line is sutured in and it all looks good. If there would be another dressing under there, I would note it for COCA, so color, odor, consistency, and amount. There was no dressing on there, but I would also note that. So with that, I can take off my gloves and I can wash my hands. And then I'm going to put on my sterile gloves. Okay. And I can get rid of this because I am not going to use this. I'm going to go ahead and open up my alcohol swabs and get those ready. Okay. I'm also going to open up my prep pad. This is an alcohol pad. I know that we're just going to assume that it is a prep pad. Open that up and get that ready. And then I'm going to grab my tweezers. So I'm going to go ahead and grab the line here and take one of the alcohol swabs, and I'm going to, in a circular motion, I'm going to clean off any dried blood, anything that looks like any sort of discharge or anything like that. I'm just going to clean that off. Okay, so now I'm going to take, and I'll leave time for that to dry. I'm going to go ahead and after that dries, take my chlorhexidine. I'm going to snap it so it's punctured. So snap it, and I'm going to vigorously rub 2 to 3 inches on each side for at least 30 seconds. And I'm going to, okay, and I'm going to allow for that to dry. Okay, after that dries, I'm going to take my prep pad and I'm going to wipe on all 4 sides. Okay, and then I'm going to gently set that down. Then I can throw this away. Then I'm going to take my Tegaderm. I'm going to open that. And I'm going to place it on this spot here, making sure that it is secured on here. Okay, and then on here I can take a pen and I'm going to write the date, the time, and my initials. And I'm going to put that here for a little bit more of a security for the line. After I'm done, I can take off my gloves. I can wash my hands. I can take off my patient's mask. I'll wash my hands. I'll take off my mask. And I'll wash my hands. And I'll put on some gloves. And I will throw away the rest of my things. Take off my gloves. Wash my hands. I would ask Jennifer if there was anything else that I could do for her. She says no. I'll lower the bed, provide for safety, make sure that she's comfortable. Before leaving, I would wash my hands. A lifespan consideration would be maybe if I had a child, I would put on some TV, distraction. If I had to have an assistant, I would have them also wear a mask to help, distract the patient possibly. And then leaving the room, I'd wash my hands. And then my documentation, I would document the date, the time, all of my assessment findings. So, Rita, COCA, my measurements, if there was any changes, and then if there was any problems that went on with what happened. All right, thank you.